again, pharmacy colleagues. Once you have created your account, the first thing to do is to log in and click on the Resources tab. All new users, whether they are pharmacists or technicians, will need to watch a short series of videos and take a small quiz. It's not a huge exam with difficult questions. Just be sure to pay attention to the videos. They're pretty short and you'll be fine. Another thing to note is that you only have to do this once. So if you leave the company and come back 3 years later or go to another pharmacy, it doesn't matter. You'll be a user of record and you won't have to do this again. So anyway, start by clicking the first link to watch the first video and work your way down, and then it will allow you access to take the quiz. Another thing I'll point out is if you ever have any technical difficulties or password issues that you can't resolve on your own, you have to contact Outcomes. I can't help you with those issues for Outcomes. I can with Marixa, but not for Outcomes. So notice that there is a phone number at the bottom of the page. Make sure you enter their number in your phone in case you ever need it. After you have taken the quiz, you will then have an active dashboard and be able to see and complete your tasks. Now, when logging onto Outcomes on this day, the screen showed these numbers. And the first thing to notice is that it says there are no high priority patients or cases which need immediate attention right now. And this will always be the first area you look at when logging on and seeing what needs to be done. So here, there are currently no claims that you have been working on, which still need to be submitted. There are currently 8 patients in progress, and this represents all task types, which we will look at as we go along. And here it shows that there are currently 0 scheduled CMRs. CMRs are comprehensive medication reviews. These are tasks that must be completed by the pharmacist only. There are things technicians can do to help get information and records organized for the pharmacist to complete, but this is one of those that it's only the pharmacist who must complete the CMRs. So when we log in on this day, we see that there are a few tasks showing, and these happen to be TIPS, T-I-P-S. And again, we'll get into the different types of tasks in a few minutes. And you'll notice that there are these percentages listed next to each patient. Outcomes works with these patients, third parties, their insurance. So they have all the pharmacy claims information for these patients, not just for our pharmacy, but for all pharmacies that these patients fill at. So this number represents the percentage of pharmacy claims which are submitted from your pharmacy. So if you see 100% next to a patient, it means they get all their prescriptions filled at your pharmacy. Now, it'll obviously be easiest to focus on and complete these claims because you have all their records and you see these patients all the time. The lower the percentage is, the more difficult it might be to work on or complete these claims because you don't have all the pharmacy data, or the patient might not feel comfortable talking to you if they fill 80% of their prescriptions at another pharmacy. Now, it can still be done, and don't think other pharmacists and technicians aren't doing it. They are. Our stores get calls from other pharmacies frequently to get filling information on our patients so they can finish and submit the claims. Now, we really don't want to let this happen. It's not good. So anyway, let's click on the first tip and see what it looks like. Now notice after you click on an identified patient on the dashboard page, the main page you see when you log in, there will be several tabs on the next screen, and the only one you really will likely be focusing on is the To-Do tab. because it tells you what needs to be done. The other tabs provide background information on the patient, or ID numbers, or plan type, and medication profile, prescription history. Anyway, so this tip is an easy one. One tip has been identified by Outcomes for this patient, and they've identified that this patient just needs to have a medication refilled and that their current prescription is expiring soon. So obviously we just need to send either an electronic request or send a fax to the patient's physician to get a new prescription, so that when it's time to be refilled, they can get it filled right away and don't have to wait for a week or 2 weeks to get a new prescription back from the provider. So when you click on the highlighted line, needs refill statin expiring soon, it will open a box. There is background information about the tip in the box, and all you really need to do to complete this claim or get it started or to clear it out of your queue is look at the bottom line. It simply asks if the patient is currently taking a statin medication, yes or no. So you can look in PDX and go through the patient's profile, and have they been taking this, in this case, the drug is lovastatin. So have they been taking lovastatin or any statin in their profile? If they have, click yes. If you don't see lovastatin or any other statin when you scroll through their history, click no. Now this screen, I'm only showing you for completeness. Remember, I said that you're really just going to be focusing on the to-do tab. Well, this just shows you what information is behind the basic info tab, that's all. This is what information is on the medication profile tab. The one thing that could be done on this screen under a pharmacist supervision is to add patient allergies and health conditions that may have not been recorded yet, or that the patient may have developed recently since their last doctor visit or their last pharmacy visit, and it's new and it can be entered. And then at the bottom of the screen, you can scroll down and see what the medication's profile is. And where this is most useful is if you are completing claims on patients who don't fill all or the majority of their prescriptions at your pharmacy. Remember, you can tell by looking at the percentages we talked about that are listed behind the patient's name on that main dashboard page. Now here I just wanted to show you close up that you would see the drug, the prescriber, and then at the bottom of the medication profile page, you can add a new drug to the patient's list by entering it in manually, then click add. And again, I'm only showing you these few screens so you know what's on them, but you can really do most of what you need to do by focusing on the to-do tab. Unlike the medication profile tab, which shows the medications in general as an overview that the patient is taking, the RX history tab gives specific filling information, fill dates, quantities, day supply, etc. And here we have just scrolled down to the bottom of the list on this page. And if there were more prescriptions, there would be arrows to click on to go to the next page. This is the MTM claims tab. And here we would see any claims for this patient and the status, whether it's in progress, pending payment, pending review, completed and paid and closed out, whatever the status is. And notice at the top right, there's a box that if we wanted to send a fax to the patient's doctor, we could do it here. And again, you won't likely be doing this, but you certainly can. I'm just showing you this for completion. Now, if we clicked on the Create Prescriber Fax box, you'd see a couple of drop-down boxes. The first box is to select which of the patient's doctors you want to send the fax to. And these are doctors which are already in the patient's profile. It's not like PDX where you can choose from any physician in the world. And if you needed to see the patient's records or history again, while creating the fax, you can click on the patient's profile box up there on the top right. And the second drop-down box is to tell the prescriber what pharmacy you want them to respond back to. Remember that the patient might be filling in other pharmacies, so if you were completing claims on those patients, you can find out what doctor to contact by looking here, or instruct the prescriber to send the prescription to that pharmacy. So if you scroll down a little, you see a box under Introduction. This is where you can type in any header or reason for sending the fax. Here, the staff member typed, "I recently reviewed the medications of Mrs. X. If appropriate, please approve the following recommendation." Then scroll down to the bottom and click Add a Recommendation. And here's where you can actually type in the recommendation or requested medication refill. So let's zoom in a little closer. Here you could type in that according to so-and-so guidelines, the patient could benefit from the addition of a statin drug. But this really seems too time-consuming to do this each and every time that a patient is identified with a tip to complete. So I've actually created some standard fax forms for you so that this time-consuming and repetitive step can be sidestepped altogether. And I'll talk about the forms that I'll be sending you a little bit later. Anyway, from this point, you could preview your document, or you could create and save your final document. And then it will allow you to print a page to go ahead and fax off. Now let's go back all the way to the dashboard page and look at one of the other areas in outcomes really quickly. Look at the MTM Opportunities link. If there are other patients, maybe ones who don't fill all their medications at your pharmacy, or maybe your patients who have other activities that can be completed other than tips or CMRs, well, you would be able to locate them here. In other words, instead of, remember when you logged on and the patients who have been identified with activities that need to be completed at your pharmacy will automatically appear at the bottom of the first page where we clicked on their name to see what kind of tip it was? Well, there are often other opportunities and other plans which have other features that patients can benefit from. And if they were available, they would all be listed here. So this is a good place to go if you decided you are going to be one of those technicians who is really going to show your strengths and run with MTM. You could not only complete the claims which auto-populate, you can actually go in looking for more opportunities to complete as well. You would be a rock star. Okay, so what is the box at the top right corner? This is called adherence monitoring. So what is this? Sometimes the activity that will pop up for completion that a staff member will need to check a patient's filling history to determine if the patient has been adherent with filling and picking up their refills on time for certain medications. Well, what medications? What type of medications do patients' insurance plans want to be sure that they are filling and picking up timely? Well, although it's obviously important for patients to take any medications which are prescribed, different healthcare agencies and people who analyze healthcare data have found that it costs everybody less when patients are adherent to certain classes of medications that are for chronic or long-term conditions. For instance, statin drugs like simvastatin, when taken properly without long gaps in between their refills, can prevent heart attacks and strokes by reducing the plaques in blood vessels. So it all boils down to the old saying, an ounce of prevention is worth a pound of cure. It is cheaper not only for insurance plans to pay for a patient's refills of statin medications than it is for them to pay for the patient's open heart surgery and a hospital stay. But it's also cheaper for the patient and the whole healthcare system overall. So the kinds of drugs that MTM looks at for adherence are typically the drugs which treat high cholesterol, diabetes, and hypertension or high blood pressure. Now, some plans are different. They also look at other classes, but these are the three big ones that all plans really focus on. So here, cases will pop up when a patient's checkpoints are due for pharmacy staff to go into PDX and check to see if a patient has been adherent in filling their refill prescriptions for these classes of medications on time for the last several months. Now here you see it says that once a patient is identified for an adherence tip, then you will see their case pop up in outcomes every quarter as a checkpoint for you to check their adherence and record it in outcomes. Did they refill on time? Did they not? Yes, no. Now the goal set by the patient's plan is for the patient to be 80% adherent. So at the end of the year, the plan looks at each patient and how well the pharmacy counseled the patient and or encouraged the patient and got them to stay on track with taking their medications, keeping up with their refills in a timely manner so they don't miss a lot of days. The more days they miss or the longer the gap between refills, the lower the adherence rate or percent is going to be. So when you scroll down and take a look at the patients enrolled for adherence compliance, you will see the drug name and the adherence status. Now you don't have to go into their profile and count days that the patient has missed between each fill to get an ongoing total count throughout the year. That would be ridiculous. It tells you, outcomes tells you how many days the patient has missed during that year, and importantly, how many more days can be missed before no longer meeting the plan's requirement, meaning you didn't meet the goal. This was not a successful completed task. Now, we all have those patients who want to fill their medications or not fill them however they want. Some patients will only occasionally fill their cholesterol or whatever other medication. Then you won't see them again for 6 months when they fill another 30-day fill. And when you ask them if they want to be put on autofill, they blow up and say, no, don't you dare put me on that. I don't want to be enrolled. I don't want to get all those calls from the pharmacy all the time. I'll just fill it whenever I need it, is what they tell you. But then we see there are months-long gaps in between their refills. So sometimes when we prompt them and let them know there are gaps and that they're not taking their medications as prescribed, then they'll just say something like, well, you know, I feel pretty good and I only take a half a tablet a day, or I only take this when I feel like I need to. You know how that goes. We all see it. There are lots and lots of barriers which arise when trying to keep patients on track with their prescriptions. So it may be helpful to repeatedly let them know in these circumstances that their plan, not the pharmacy, is requiring them to take their medications as prescribed to help avoid major health events. And eventually, that the cost of the patient's individual plan may take into account how adherent they have been with their medications. And the cost might be lower for patients with better adherence rates and higher for patients who aren't. To help offset the cost, the plan will have to pay for major health events for patients who are not adherent. A lot of times patients who aren't interested in adherence based on any health appeal you could make are interested if it might mean lower copays and deductibles or whatever for them. So this is one way to approach this type of barrier. Now, further to the right on that same table, it shows you what checkpoints are pending and complete, and it shows if there are any bonus opportunities for that patient under their plan. You could even filter the view down by checkpoint status. You can click on Show All, or you can click just to see the patients who have checkpoints that are due now, or you could look at just the disenrolled patients, or look at only the enrolled patients. Okay, finally, let's go back to the main dashboard page again and click on the last link at the top, the resources link. Here there is a variety of information and guidance if you are so inclined to look further at some of these. One good area to look at are some of the outcome videos and webinars that are provided by Outcomes that users can sign up for. They're actually really good. Okay, so that's going to be it for this video, Navigating Outcomes. In the next video, we're going to take a look at what you are actually going to be doing in Outcomes in a systematic and organized way that will be easy, will require the least amount of your time to complete, and that you can easily keep track of, whether there is just one technician in the pharmacy or 2 or 3 technicians. This way, everybody will know what each staff member is going to be responsible for. So again, thank you for your time, and I'll see you on the next video.